The Honourable Dr Ayesha Verrall.
Thank you, Mr Speaker. My question is to the Minister of Health and asks, does he stand by his statement, no more excuses, we measure success in one way, better outcomes for patients? If not, why not?
The Honourable
Mr
Simeon
Speaker,
Brown.
in the context it was made, yes. We know that too many Kiwis are waiting too long to be sent to emergency departments, receive first specialist assessments and have elective procedures. Our focus is on patients and delivering timely, quality healthcare for all New Zealanders. This starts with bringing back our critical health targets to drive accountability and ensure better outcomes for all New Zealanders. This has already led to key initiatives including Health New Zealand's elective boost, which will deliver an additional 10,579 elective procedures by June to reduce wait times.
Supplementary, if there are to be no more excuses, why are Health New Zealand officials appearing on TV New Zealand to dismiss concerns raised by Nelson doctors that women are deteriorating while they're on waitlists and needing emergency hysterectomies rather than timely planned care?
Mr Speaker, as the Prime Minister said earlier, the Health New Zealand has a team in Nelson to address the concerns that have been raised, to ensure that patients are being put first in the Nelson region and to get on top of the wait lists. That will include taking actions such as ensuring that outsourcing is happening. I'm advised that in the Nelson region, outsourcing has not been taking place as it has in other regions, and that is something which is being worked on. Bringing surgeons in from Blenheim to carry out more procedures in Nelson, getting teams in from other parts of the country to help get through first specialist assessment wait lists. There is a number of actions being taken to address the concerns in that community, and I look forward to further reports from Health New Zealand officials as they work through these issues.
Supplementary, what excuse can he possibly have when his government froze hiring in public hospitals, causing the number of people seeing a specialist within 4 months to fall from 66.3% to 61.2% within a year?
Well, Mr Speaker, I reject the premise of what the member is asking. If you look at the Nelson Hospital, there has been an increase in clinical staff at that hospital since we came to government. What we are focusing the system on is ensuring that we are delivering more, and I acknowledge that there is more work to do when it comes to wait lists, both for first specialist assessments and elective treatments. That's why we have done the electives boost, which is about making sure we can get more treatments done for New Zealanders faster, and I hope that the member will support such initiatives.
Is it acceptable that women with gynecological conditions so painful they cannot go to work are being told to wait a year for treatment? And if not, will he give Nelson permission to fully staff its hospital?
Well, Mr Speaker, I acknowledge that there are too many Kiwis waiting too long for treatment, and if the member looked at the track record of her government, would realise that this is a problem which has grown over time, and what we are focused on doing is ensuring that the focus goes back on the patient, that we are delivering more treatment, and I welcome the member. I hope the member will support the elective boost, which is about making sure we get more treatments done by working across both the public and the private system so we can get more done for Kiwis.
Supplementary, if there are to be no more If there are to be no more excuses, why is he blaming the last government when Dr Claudia Hayes, head of Nelson's Obstetrics and Gynaecology Department, is saying on television they've never seen wait lists as bad as they currently are?
Well, Mr Speaker, the wait lists have grown over a period of time. I have been appointed as the Minister of Health to address these issues and to make sure that patients are being put first in the system so that we can get on top of them. And that's why, Health New Zealand is undertaking the electives boost, which is about maximising the number of elective treatments across both the public and private system so more patients get the care they need in a timely manner. And I hope the member and the Labour Party would support such an initiative.
Will he respond to vascular surgeons in Nelson Hospital who are saying people on the wait lists are having unnecessary emergency amputations because of the lack of surgeons, and will he allow Nelson to fully staff its hospital?
Well, Mr. Speaker, there are more clinical staff working at Nelson Hospital today than there was when she was the Minister. There are more there today than when she was the Minister. And what I would say to the member is that is why we've put a team into Nelson Hospital to work with the local staff and to make sure there are teams working across the Nelson Marlborough region to get patients the treatment they need in a more timely manner. I do not accept that the patients in Nelson are getting the timely treatment that they need. Those wait lists are unacceptable, and that is why we are taking action.